Then we were on the front line. We were seeing the struggling. We were seeing the suffering. We were seeing the people losing their breath and dying. We were sending thousands of patients to the hospital. 9 of each 10 died. That was difficult. It was difficult not to have a country prepared with PPEs, not to be prepared with testing in any direction.
Dr. Ramon Tallaj is the founder and chairman of SOMOS, a network of healthcare providers serving disadvantaged communities in New York City. He and his team have battled the coronavirus since the start of the pandemic.
At that time, somebody said to me, "Oh, look at what happened in Italy. It's not going to happen here." I said, "What are you talking about? That was coming to us. We need to be prepared." And we're talking about February. That's when we start preparing for this. My partner, Dr. Henry Cheng, is from China, and his group. We look what happened in the whole Asia area. And we start preparing to have PPEs, buying whatever we could find it to do the test. Also, we instruct to have telemedicine for all of our practices. We're talking about the beginning of March. Some people were saying even don't use masks. We knew this virus, the SARS, is coming in the air from the beginning. We didn't wait for the authorities to say, you must use masks. We, from the beginning, did a webinar from any state we send it to tell them, get your mask, isolate your people, especially the elderly, otherwise they're gonna die.
COVID-19 did not affect everyone equally. Dr. Tallaj knew that the population with the fewest resources was going to be the most vulnerable.
Just the inequality was there. From the beginning, it was clear that this virus was affecting more the people who were essential workers because they had to continue working. Then the first testing site that we did in Queens showed up 70% positive. But those people were coming back to their houses, to their apartments, small, where family lived 3 generations. What's going to happen? People are going to die. 3 generations of people who are not well treated, don't have enough resources, plus a lot of people without documents that need to continue working, otherwise they cannot live. That mix was a nice soup for the virus to go there and kill people. And that's what happened. We asked for isolation places, hotels, gyms, schools, to put beds and put everybody together there. All the positive people should be there. It didn't happen. Nobody recognized the hotspot but us. The authorities who were supposed to go and track and trace were hiding. They were afraid and they didn't hear what we were saying. That's why so many people died. Because we ourselves brought the virus to our building. Yeah, isolation for the rich, for the elite. Did you imagine an authority from Washington saying that they want to have games in April with poor people, but the poor people have to be with no public, no fans, but they have to be isolated in hotels and be tested every 3 days? Say, my God, I cannot get one school to put beds and isolate people, track and trace them, and do the right thing. This man wants to do that for the sport elite. But not only that, he wants to test every 3 days. I can't find a test to do in my community who's dying in a small building, essential workers. And I say, but why he want to do that? There will be no fans playing. No fans playing. Why he want to do tests and they're going to be in isolation? You know why? Because the LACRA, the lepromatous people of the country, us, the Hispanic and the African American, were the one who need to serve the food, dry the bus, clean their rooms while they're in the hotels. What a mess.
For Dr. Tallaj, it was time to make important decisions.
March 26, already almost 20 days inside that battle with the virus. The first testing site was the 15. We knew it was a nightmare. First, we started to pray. And we've been doing that since then. I've been doing that all my life, but as a group, with all my employees and many other people, every day at 8 o'clock. Yes, We were afraid. And I'm concerned that I put so many other people at risk, but we knew it was our duty to be out there for our people. Nobody else would do it. Yes, afraid. But what happened we haven't done that? What happened we haven't teach people? What happened we haven't put a TV program to tell them how to behave? What happened we've been giving masks in every single place through the city, to hospital, to the police department? What happened we haven't given meals when people has no money, with 3 kids and no job and no insurance? What happened when we distribute so many masks, so many cleaning things? What happened? It will be happening worse.
Dr. Tallaj, his family and associates were not spared. His family was hit extra hard.
I also put in risk my family. 3 of my kids got the virus, one of them working with me from the beginning in the stock exchange, in Queens, Brooklyn, bringing the food to the people who were working in those areas, delivering the products, finding PPEs. I put in risk. One of them spent 10 days inside his apartment. We were delivering food on top of, from his door. Fever 101, 102. One of my daughters spent 20 days, 10 in the hospital. She almost died. They were working in the hospital. Yes, we were afraid. We were more afraid not to save lives. Action, even in the higher cost, was the way we decided to confront this virus from the beginning. And that's why so many people died in our group.
He does not forget the physicians who died serving the community.
It's Dr. Deku, one of my board members, called me, his wife, telling me he's gone to the ICU, he's gone to the hospital. So let me talk to him. He actually was able to even say to me, I can't, he wasn't able to talk. I knew right there, his oxygenation must be very low. That's the last time I talked to him. I had another dentist from the group with diabetes who got admitted. He also died. Another ICU, an intubation, who died. He didn't recover. He died too. As a matter of fact, he was thrown in the truck. And then to have to find the way to get his body from inside the truck. Find a way to identify which one was him, his family. I don't want to go into those people that I know who die inside the buildings, that the family called asking me what to do. And it was difficult. There's nothing we could do. The hospital don't want to take them. They were so sick already. And they died in home.
Dr. Tallaj pulled all of SOMOS's resources to fight against COVID-19.
We ourselves put 23 million of our own resources on the spot from the beginning to buy PPE, to buy the minimum, the place where to test, like this beautiful place to do vaccination. We create centers to do testing inside through the city. But we also ask for isolation. We create pamphlets. We had 1833 SOMOS NY to give information to people. To the people without insurance, people without papers, for anybody. We had 3 different languages answering to anybody who want to know what's going on. Because we knew this virus was going to be lethal, especially for our people. We haven't been getting any money back from that money we spent, but we don't care.
SOMOS has vaccinated thousands of disadvantaged individuals, especially Hispanics, Asians, and African Americans.
Queens, Manhattan, the Bronx. Now, in our community, 40%, 45%, whatever way you take it. Now it's 20-something% vaccine that SOMOS has been doing, like in this place. We're close to 70%. Still could give us problem, but not that much.
Dr. Tallaj does not consider that the battle against COVID-19 is over. He has very clear advice for everyone.
If you have 2 vaccines, take your mask out. And I say, wait a minute, not so fast. If you are a young people, not vaccinated, and get the virus, you will survive, most likely. Some people die, young age. If you are vaccinated and young, you have more chance to survive. Those ones I will tell, take the mask out for elderly people, with or without secondary disease. Without vaccine, no question, you could die. With the vaccine, keep your mask when you are in places where you don't know the people, inside crowd places, because you could get the virus. Remember, I'm the first one. Almost everyone is going to get the virus in this country. The difference is how it's going to find you. Without the vaccine or with the vaccine? It's no question. We need to have the vaccine to be able to help us more than we don't have it.
Ramon Tallaj created the SOMOS network of healthcare providers in 2015. Back then, he believed this initiative was necessary. Now, he is convinced that SOMOS is essential for America.
Looking back, it's been hard to see how we were so unprepared, so divided, so unwilling to act together. Our leaders need to understand the importance of saving lives and do the right decision for the common good. I exhort the leaders to look for the common parts and work on it. It's not happening. It's not happening. And I'm afraid that any other pandemic or other country will attack us and will find us divided. Worse than the Civil War in the 1700s. Here, we were fighting with an invisible enemy, a virus. We were discussing and fighting while he was killing us. 600,000 or 300 million. Not a joke. Trust me in this. Small people out there suffering for the sequelae of this disease, psychologically, because of how the parents die or the grandparents die. They have no jobs. They are depressed. They have symptoms in the heart or in the brain. The country, 500,000, easy. It could become 3 million people having this, 1%. I started SOMOS because I saw the need to change healthcare in America, in our neighborhoods. How come healthcare will be based on buildings? No. The human life and all their needs in their communities is important. That we call value-based quality, value-based payment. It's not a transaction because I need money to pay payrolls. Yes, we need those buildings, but we need to save the community. This is why SOMOS has so much reserve of money to put it into the game when this pandemic hit. We were prepared to buy PPEs, to buy tests, to give food, to take care of the needs of the community as a whole.
To carry out the mission of SOMOS, Dr. Tallaj relies on his Catholic faith.
Was been my whole life dedicated to work for others in poor neighborhoods. At the service, I never have a practice in rich places and people who could pay afford. I just always work for poor people and go to places that it's difficult to understand why. We go to Haiti or Puerto Rico or Dominican Republic, all these places that we do so much in services. But I gotta tell you one thing, it's clear to me. Now, why we're here? To take care of the poor, to feed the hungry, to take care and treat our patients. And the most important, somebody said a couple of thousand years ago, to take care and treat the others the same way that we would like to be treated. If we do that, we won't fail.
His calling to serve vulnerable populations began at a very young age.
The vocation is of my family, it's a generation. I grew up with my uncle, pediatricians. I saw the suffering, young children, going to see him very sick. It was so important, so many diarrhea in my country because of diseases. In a poor country, I got my cousin who died from cancer. All of that made me feel that take care of others. And that way was important. And I tell you the truth, I'm being blessed to be able to do what I like to do and be able to have some resources that I could extend that not only to my patients in my office, to extend that to a large population. God has given me that kind of reward to be able to do that now for people at large.
The presence of God is the backbone in his life.
I pray every day. I understand the importance of the prayer is because you have to remember every day who you are. Just to remember myself, that I'm nobody. He's in charge. He's the one who decides, and nobody else. I get you embarrassed. But obviously, after he said, you have to love the Lord above everything, with all your heart, all your soul. The second part is how to deal with the others, to treat the others the same way you would like to be treated. And that's our motto. And sometimes it's difficult because we are humans. But I follow that. And one thing that happened to me during this pandemic has nothing to do with that. It was a time when I was trying to convince the priests and the pastors to allow us to do testing everywhere, all the churches, all the congregations, and they tried to walk out from me. And I said to them, cool about this. They looked back and said to me, why do you say that? I say, because I'm trying to tell you what your job is today. Open your doors, come back. Yes, we could die doing tests here. We could be infected. Yes, we all could do that. But that's your duty, to take care of the community now in difficult times. You have to come back like Peter did when he was leaving Rome, afraid because he wanted to be hanged. And Jesus, cool about this.
Almost 2 years after the pandemic hit, Dr. Tallaj is a changed person.
Yes, now I'm different because there is security in the meals, security in education for my kids, probably grandkids, housing, health, and the way health means that we have resources to deal with that. But it changed because now we need to use all the resources that we have for what the mission is. Take care of the poor, feed the hungry, take care of the sick, and try to do things for the others the same way they want us to do for us. And I know it's a lot of support that they are giving us in materials, things, tangible things, including money. But I'm changing all of that to be used for the benefit and the goods of the others. I'm trying to gain more doing the thing that the Lord wants us to do.